And I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by LaQuandra Nesbitt, the district's director of D.C. Health, and Christopher Rodriguez, the district's director of Homeland Security and Emergency Management. I'm here today to provide a briefing about the district's response to COVID-19 in the week ahead, and then we will take any questions. This morning, we announced 49 new cases of COVID-19 in our community. And here, you also notice the metrics that we follow each day at coronavirus.dc, which outline the main points of interest for DC Health in evaluating our experience with COVID-19, including the level of community spread, our testing capacity, our health system capacity, and our contact tracing experience. So continue to follow that information at coronavirus.dc.gov. Last night, we also all heard the announcement about expanding the use of plasma to treat coronavirus patients. We know that here in DC, we have nearly 11,000 people who have had COVID and have been cleared from isolation. If you are one of those people and are interested in donating plasma, you can learn more about the process on the FDA website, and we encourage you to learn all that you can and help where you can. That website is fda.gov/home, HOME. This morning, we also released an updated list of states that DC Health classifies as high risk and therefore subject to the 2-week quarantine for non-essential travel to and from the district. States that were added to the list include Delaware, Hawaii, and South Dakota. States that were removed include Montana and New Mexico. Residents and visitors can find a full list at coronavirus.dc.gov/phase 2. Today is also another important day on our calendar because it's 1 week from the start of the school year. We will share more information about upcoming school year plans on Wednesday, but parents, if you have not completed the enrollment process, please make sure you do so today. You can enroll at enrolldcps.dc.gov, enrolldcps.dc.gov. Term 1, as we have already announced, which runs through November the 6th, is all virtual for DCPS. We need to make sure every student has the technology they need to participate, and if you have not requested a device or internet access, you have a few options. First, you can call your school directly and talk to them about your needs. You can still fill out the technology survey at dcpsreopenstrong.com, and you can call DCPS 202-442-5885. So we want to make sure all students and families are connected. If your student is at a DC Public Charter School, please visit the DC Public Charter School website to connect to your individual school for more instructions. If you've already requested advice but don't have one yet in your possession, you can also call your child's school directly. So with that, I want to hand it over to Director Rodriguez to talk about HCM planning for the upcoming week, and then we will be available for your questions.
Thank you, Mayor Bowser. What you see here is some of the RNC sites that we know that some activities will be taking place over the course of the next week, really through Thursday. So you see some of those sites there. Next slide. And then, of course, we're also planning for the March on Washington on Friday. And here you will see a map of some of the road closures as well as some of rolling closures that we might see on Friday as well. It's important to note that We at Homeland Security and Emergency Management, MPD, FEMS have been in touch with the organizers of both events over the last week, as recently as late last week, to ensure that any city services that were being asked for or required that we were able to provide to ensure that all events go off safely and securely. Thank you, Mayor.
Thank you. Any questions? Yes, Sam?
Just quickly, the Engine 2 fire station, why is that part of the Republican?
That was just there for reference, Sam.
Oh.
Yep.
Okay.
Any other questions? Sam?
Yes, ma'am. The commitment march, that is, I understand, on Friday, and I've looked at some of their information as to what they are doing. Is the city going to be monitoring how this goes in any particular kind of way?
I didn't hear the first part of what you said.
I said that the commitment march is on Friday.
The commitment march?
The March on Washington.
March on Washington,
Is on Friday, and I just curious that I've seen some of their information, and I'm just wondering, is the city monitoring this in any way, or is it sort of leaving it up to them?
Thank you for that. I'll ask Director Rodriguez to respond.
Yes, Sam, since the March on Washington was announced, we have been in constant contact with the organizers of the National Action Network. And we are meeting with them several times a week virtually to make sure that, again, any city services that are being asked for that we are providing. As you know, most of the events for Friday will be taking place on federal property. So we've been in close contact with the Park Police as well. But our traditional public safety services will be provided. So MPD and FEMS will be out there. We've also requested National Guard support to make sure for traffic monitoring, to make sure again that the event goes off as safely and securely as possible.
And will the buses be parking at RFK?
Yes,
situation?
they will be parking at RFK.
With regard to everything going on this week with RNC activity, potential counter protests, and then Friday's, large march, how many people are you expecting to be in the districts this week?
Well, so I think it's important to note that we do this all the time, okay? And so we host major events. We are well prepared to also support multiple events going on in the city at one time. And the key here is, of course, that we're dealing with a global pandemic. And as the mayor has said many times, anyone who wants to come and march needs or attend the event needs to make sure that they're doing so in a safe way, and being mindful of the fact that we are under a global pandemic right now and dealing with that.
Yes. Can I ask you about Delaware being added back to the list of states? First off, for the folks who went this weekend because the state was removed, now it's back on. What are you advising those people to do? And then just if you could just clarify for those people still asking why, if, for example, the Maryland positivity rate is going up and places like Ocean City, Maryland have seen increases, that why those places, for example, are
I think we said pretty clearly from the outset that we think it's impractical for our neighbors in Maryland and Virginia to be a part of the quarantine list, and that statement stands today. If we feel the need to change that, we certainly will advise that we change it. We also are pretty clear about how you're on the list or off the list, and that is based on the experience in the state at a given time, so it can change. And we update our list twice per week. Once every 2 weeks.
So the guidance that since the list came out, I believe yesterday, last night, those folks that were in Delaware this weekend?
I'll ask Dr. Nesbitt to address that.
The list is updated at midnight. In addition to posting the list, we have our guidance for travel and how essential travel is defined. We also have guidance in terms of assisting people in making decisions as to whether or not they are going to travel. Residents of the District of Columbia should now be aware that if they are making travel plans, and as the mayor has stated, states are subject to being added or removed from the list every 2 weeks, and people should take that under advisement when they're making their travel plans.
Okay, any other questions, guys? Yes, Sam?
Yes, Mayor. Just a comment, if you would. We had a 5-year-old and an 8-year-old shot within a 24-hour period, Thursday, Friday, and I'm just interested in your view on this.
Well, Sam, certainly we're shocked and saddened by those occurrences. We are still investigating, and in at least one of those cases, I understand that the police have a good lead as to who might have been doing the shooting. And we want all communities to know that we need to hold people accountable if they are using guns in our community. So we will continue to update you on that. I can't say more about the conditions of the children, although I think that we were very lucky. Yes.
Mayor Bowser, just a couple of different questions, and I apologize if you responded to this on Friday, but the ACLU added Chief Newsham to the suit, and there have been accusations from those involved that you yourself, given that you oversee the police department and matters in the city, that they're accusing you of kind of doing what the president did and allowing protesters, peaceful protesters, to be subject to activity like tear gassing and whatnot. Can you respond to that lawsuit and any accusations?
We will respond in court like we do to all lawsuits. Any other questions?
Can you just clarify, there's also accusations that Black Lives Matter Plaza was cleared ahead of the roll call recording or presence that you made in the DNC. Can you just clarify if that was done or not done?
I don't know what you're talking about. What are you talking about?
There's accusations that police were involved in clearing Black Lives Matter.
I don't have any knowledge of any such thing, and I was there in Black Lives Matter, and there was really nobody there that evening.
Okay. And then also, just one more, I'm sorry. You were putting out just information for parents getting ready for school, making sure they pick up the technology needed and whatnot. What's the reminder to parents, the importance of picking up the technology, but also any response to the Washington Lawyers Committee also claiming that for 6 months, students with disabilities at the Youth Services Center in DC jail have not been receiving their education.
Say that again, Stephanie, I'm sorry.
Sorry. The Washington Lawyers Committee, they are claiming that for 6 months, that students with disabilities at the Youth Services Center and DC jail, that they were denied appropriate education, that they've only been receiving packets, educational packets. Is there anything to address that?
I'm not familiar with that, but if they're talking about children who are in our custody and are at one of our facilities, congregant facilities, is that what you mean?
That's what they're saying.
Okay. I don't know specifically, but all of the services have been adjusted to keep people safe from COVID transmission. So I wouldn't be surprised if there was some adjustment to the services for children too. Is that it?
Well, I guess there's not really an answer to this, but if you're telling parents and giving parents information to pick up their technology, how that might be addressed with those students.
I don't know that they have a technology issue. Is that what the allegation is, that they don't have technology?
That they weren't basically given the education that they're legally allowed to, that they only receive information on the packet.
Well, I don't know. I can't comment on that until I know a little bit more, but I can say all public education has been modified, and none of it to my satisfaction, because I want every children in a school building in front of a teacher. So given that we're dealing with a global pandemic, services for all children has been modified. So that's something I'll have to follow up with to make sure that it is all that we can do for those kids, given that they're in an especially difficult situation because they're in a congregate setting. And we know that congregate settings, especially early on in the pandemic, have been the most, we've been the most concerned about the transmission of COVID. Okay. Sam, did you have one last one?
I have one last question. We're seeing that the daily death numbers seem to be pretty low. I think this was another day of no deaths in the city, and we're seeing one or none. Does that influence at what point you would consider moving to phase 3, or at least lessen some of the restrictions in phase 2 based on this kind of information?
I'll turn to Dr. Nesbitt.
Hi, thank you for the question, Sam. We are not going to base our recommendations on the number of deaths that are occurring. While not having deaths is definitely something that we see as a positive in the district, the amount of disease is also concerning for us. Unfortunately, we cannot predict by virtue of who gets sick, who will die. So we don't want to base our recommendations to the mayor in terms of moving into another phase or allowing additional activity in the current phase that we are in, phase 2, based solely on the number of deaths that we are seeing. So we will not be using the number of deaths in the district as an indicator by which we will move into a subsequent phase. What we are noticing in terms of our cases, and we've talked about this before, is since the July 1 timeframe, a higher proportion of our cases are occurring in the 20 to 30 age group, and actually in younger age groups overall than they were prior to July 1. We continue to observe that trend even if we just examine the data after August 1st. So it doesn't mean that individuals who are over 65 still aren't being impacted or that they aren't at higher risk for severe illness, but we don't drive our decisions based solely on seeing a decrease in the number of deaths in the district.
Does it depend to any degree on the surrounding jurisdictions, their numbers in terms of influencing you as to when you move out of phase 2 or at least loosen some of the restrictions?
Oh, that's a wonderful question, Sam. So we have very porous borders, and so some of the things that will happen in the district, depending on what activities we turn on and off, can impact the numbers that we see here. So for example, if we have more businesses moving out of a telework posture, we know that more people who live in the National Capital Region and work in the district will begin to come back to work. And that can have an impact on the number of cases among district residents who may come into contact with those individuals who contribute to the case counts in those surrounding jurisdictions if they are in fact having exposures in the workplace. So it doesn't solely contribute to our decisions, but that would be one of the things that if we were to make recommendations to businesses or workplaces that we felt comfortable with advancing or making a recommendation that telework could be rolled back, we would have an expectation that individuals who live in the National Capital Region and work in the district would now be coming back into the district, and that could have an impact on the case counts in the district. The mayor has spoken about how critically it is important for us to be aligned, for her to have conversations with the governors, for us to be aligned with other counties' decision making, because certain activities being available in other jurisdictions and not in another one just moves that social activity around the National Capital Region, and that can impact case counts as well. So we do have those conversations. We do work to have alignment, but our decision making isn't solely a function of case counts per se, incidents, hospitalizations, or deaths in one particular county or state individually. Does that help answer your question?
Yep, and finally, and I know you've probably gone over this before, but
That's okay.
What
I've gone on over a lot of things more than once, if that's okay.
What will get us to phase 3?
The metrics that we have, that we show here are principally the things that we are looking for to make a recommendation to move to phase 3. And we began to manage those expectations very clearly back at the end of June when we entered into phase 2. That phase 2 would be a much longer haul than phase one. And particularly because we're not only looking for declines in the number of cases that we see on a daily basis, but because we're looking at the nature of those cases and their relationship to one another. We would much rather begin to see clusters of cases as opposed to individual cases not being connected to one another in order to indicate that it would be okay to move into phase three. I'll also remind you that there are some things that we had anticipated being able to allow in phase two that are not happening in phase two. So you all should have in your mind's eye that there may be activities that could be recommended to happen again that would signal that we're still in phase two with more activity, but not necessarily transitioning to phase three. For example, in-person school is considered a phase two activity. We had anticipated being able to have some additional forms of entertainment in phase two through the waiver process. We had to delay that. We anticipated having swimming, our pools open in phase two. We made decisions to delay that. So there's still a host of activities that we delayed in phase two because our indicators weren't exactly where we wanted them to be. Phase three imagines things, if you go back and you look at the Reopen DC Advisory Committee's recommendations and how DC Health would interpret those to make recommendations to the mayor, would imagine us having mass gatherings at much higher levels, would imagine us having a different level of telework, would increase capacities at some of the indoor activities that we are having. So there's a different environment from a public health perspective that would have to be in place in terms of the cases being connected to each other that we would need to be in phase three. And it doesn't necessarily mean that we have to completely get there before we turn on some additional activity in phase two. Thank you.
Okay, any other questions? Okay, Stephanie?
Dr. Nesbitt just spoke of the importance of how you've been communicating with the area's mayors and, governors and the close relationship within the jurisdiction. Do you have any reaction to Montgomery County Council voting today to change some of their measures? Specifically, they had approved to reclassify soccer as a medium risk sport and allowing other things like bowling alleys and museums to open. Does that impact this jurisdiction in any way?
I'm not aware of the council's actions, but we have been very specifically following DC Health guidance around activity levels. As you know, we went through a very, it wasn't a long process, but it was an intense process around evaluating those activities and classifying them in phases. And I think Dr. Nesbitt just gave a very thoughtful summary about where we stand with phase two, what types of activities remain in phase two to be turned on, and getting beyond. Thank you, everybody.